Hi, hello. Today we are going to see about barrier nursing. From the picture you can understand what is barrier and what is nursing. Barrier is something we have to prevent ourselves from the infections, or we will be defending about the infectious causing agents by defending ourselves by using some protective equipments like gloves, mask and aprons, etc. Today let us see what is barrier and how come a nurse during taking care of the patients in the hospital can prevent infectious diseases to happen to them, or the nurses or the medical staffs who is taking care of the patients also must be protected themselves, and also they have to get protected from the infectious patients also. So today let us pass on to what is barrier and barrier nursing, how come it can be taken care during the practice of clinicals in the hospital by a medical staff. Barrier nursing is nothing but there is a set of good compulsory strict interventions, or which we call it as infection control techniques while taking care of the patients in the hospital in everyday clinical life. So barrier nursing is nothing but a set of strict infection control techniques which will be followed by the medical staff, not only by the nurses but also by every medical staff who is taking care of the patients at the hospital. This is nothing but infection control techniques. And why does this is so important? Because the nursing techniques, while we are taking care of the patients, what we are using in the hospital for stopping of the infectious spreading from one person to another is called as barrier nursing or barrier techniques. And why does this being used? To prevent infectious diseases from one person to the another. So if I am a medical staff, I am taking care of my patients in the hospital, but I have severe infection in my body, and where I do not want to give my infection to the patient who I am taking care. So what can be done? I can use some stopping techniques or some preventing techniques, which we call it as barrier techniques. Barrier techniques will be used to protect nurses themselves from the infectious patients, that we call it as barrier nursing techniques. And there is another reverse system also. What is reverse system? Not only the nurses protecting themselves from the patients, even the patients also has to be protected from the infectious medical staffs. That we call it as reverse barrier nursing, where the infectious medical staff will prevent their infection to enter into the patients, those who are taking care of them. Okay, so that's something about barrier nursing. We'll just go forward to know what is exactly barrier nursing and what are all the important terminologies which will be used in barrier nursing is so important for a nursing student to know. Commonly, there are some used words like isolation, barrier, protective clothings, personal protective equipments. So these are some of the points or terminologies as a medical staff, as a nurse, we used to use in the clinicals for prevention of infections from one person to the another. Let me tell you one by one. The first is isolation. What is the meaning of isolation? Isolation is something keeping a person from distance from other person. For example, if a patient is having a severe infectious disease and we don't want to spread that particular contamination disease from one person to the another, or one patient to the another, we keep the infectious patient separate in a room, and that we call it as isolation. So what is isolation nursing? Isolation nursing is nothing but carrying out a technique by placing the patient in a single room or a side room or a separate room. So you keep the infectious patient in a single room where other patients will not come in contact with this infectious patient, or a side room where there will be no opportunity for the other patients to come into that room. That is called as isolation. And when you do this isolation by nurses, we call that as isolation nursing, where all your nursing care or whatever services you wanted to provide for that particular patient will be done inside the separate room. So that we call it as isolation nursing. And next I wanted to tell you about barrier nursing. As I told you in the introduction itself, barrier nursing is something which we will carry out some of the techniques which will be very strict followed by the nurses to stop preventing of infection from one person to the another. So this is something we are taking some extra precautions or extra precautions which will be implemented to prevent the spread of the germs from one person to the another. So this is, we call it as barrier nursing. So any steps a medical staff or a nursing staff takes to prevent infection or spreading of germs or spreading of microorganisms which causes infections from one person to the another by using some strict rules or strict techniques is called as barrier nursing. Now, I wanted to tell you what are all the techniques are used in the hospital by a medical personnel or medical nurse or staffs to prevent this isolation, to prevent these infectious diseases from one person to the another. There are so many techniques. Let us see one by one. The first one is aseptic techniques. What is the aseptic techniques? I will be telling you. First, let us read out all the first techniques used. Second one is isolation. Third is safer handling of sharps. Sharp instruments will be used, especially sharp needles we are using. So if a needle prick injury is happening in the hospital while taking care of a patient, that needle prick can transmit a contagious disease from the patient to the medical staff who is taking care. So even while handling with the sharper instruments like needles, you have to have a safer handling technologies to be used. So that is also a kind of technique which we use in barrier nursing. And next is linen handling and disposal. Whatever linens which you use for the patients while taking care of an infectious patient at the hospital, those linens even must be taken care how to handle and how to dispose. Even from the soiled linens infection process. Next one is waste disposal. We call that as biomedical waste management, which has to be followed strictly by the medical staff so that they can prevent the contamination of diseases from one person to the another. And then handling of biological spills. What is biological spills? I'm going to take a blood sample from a patient's body. While I was taking, I got a mishandling of taking of the blood, so the blood spilled down on the floor. That blood spilling on the floor can cross infections from their blood spilling to the person who touched that. So how to handle that biological spilling on the ward or on the bed? So that also is a technique which a barrier nursing nurse will be following during barrier nursing technologies. Next is environmental cleaning. We know hospital wards, floors, walls, instruments, everything will be cleansed now and then to avoid infection. So that is also again another important technique which will be used in the barrier nursing. Risk assessment. We have to do assessment now and then to identify where is the risk of infection spreading, either from the medical staff to the patients or from the equipments to the patients or from the patients to the equipments. So these are some of the assessments we will be doing in the hospital to understand whether there is a chance of risk of infection crossing from one person to the another. And then the final point is staff health. The persons also who are taking care of the patients in the hospital, they are called as medical staffs and nurses. These people's health also has to be taken care or has to be protected because these people will be traveling from one person to the another in the hospital. So if I'm void of diseases, if I'm free from diseases, then I am able to take care of the another patient without any fear of transmitting the contaminated disease from one person to the another. Now let us pass on to each and every techniques detailedly, and one by one let me explain this. First one is the aseptic techniques. Aseptic techniques are nothing but we call that as asepsis methodology or prevention of infections methods. So sepsis is infection, asepsis is something we call it as absence of sepsis. So how can you make absence of infection in a particular ward while we are taking care of patients? So we can use two methods. One is medical asepsis. Medical asepsis is while you are doing some simple procedures on the patients, you can follow medical asepsis technology or techniques to avoid cross-infection from one person to the another. This is done by very simple method called as hand washing. When you do clean techniques of procedures like medication administration or changing a bed cover of the patient. So this is all very simple procedures, and while you're doing the simple procedures, even as a nurse, you have to take care that you are preventing the spread of diseases from yourself to the patient. So that can be achieved by a simple hand washing procedure, which will be followed every now and then, even after and before the procedure to be done on the patient. So simple hand washing will be called as medical asepsis. Next is surgical asepsis, which we call it as a sterile technique. It is not a clean technique, it is a sterile technique where you do thorough cleaning or thorough elimination of microorganisms using sterilization methods. What are the sterilization methods? We have physical sterilization, chemical sterilization. So physical sterilization is washing with soap and water and keeping the articles in the sunlight. So the physical sunlight will fall on the utensils or equipments which we used for the patient. That will kill the microorganisms at a point. Whereas other sterilization like boiling, autoclaving, they will be put up in the autoclaving machines, and the high boiling point will be killing the microorganisms. So this is, we call it as sterile techniques or sterile asepsis, where we will be using such sterile asepsis during surgical procedures or invasion procedures. So this is the simple aseptic technique. And next I told you about isolation. What is isolation? As I already told you, it's a source of protection where you will be isolating or keeping separate of an infectious patient from the other patients. So in the ward, you can have a separate rooms or single rooms for an infectious patients to be taken care. So that we call it as isolation. Isolation is the kind of source of prevention or protection from the infectious diseases. Especially this isolation will be helpful in preventing airborne diseases. What is airborne transmission? When air is surrounded with the microorganisms, so you keep them isolated from the such airborne disease transmissions, especially droplet infections while we sneeze and cough. So while we cough and sneeze, the droplets will be present in the air and it will be circulating, and when the infectious or immune suppressive patients inhale that air, the disease will be crossed to them. So to prevent that, you can keep in an isolation room with negative pressure, so that the negative pressure and negative temperature, that is, it will not be same with the room temperature outside. So this particular room will be having filters in them or negative temperature in them, so that the air will not be getting circulated with the microorganisms. What kind of patients we can keep in isolation? Especially very contagious diseases. To the current scenario, it is about corona and pulmonary tuberculosis. We call them as TB. So these disease conditions will be transmitting. This disease condition possessing patients will be transmitting the microorganisms from their body through cough and sneezing into the air, and from that air, another immune suppressive patient will able to receive it. So such patients can be kept in the isolation wards. And this is, again, I told you, it is a source of protection technique which will be specially given for the immune suppressive patients, where their immune will not be supporting for them to avoid the infections. So such patients can be kept isolated from the other infectious patients, so that we can prevent cross infections from one person to the another. Next is safer handling of sharps. So sharps is something I told you already. It is about handling of sharp needles or sharp instruments in the ward while you're handling of the patient. So this is a prevention aspect. How you can prevent sharp instrument injuries must be prevented in the hospital while you're taking care of the patients in the day-to-day care. So this is also a preventive aspect. How you will be doing? You have to handle the sharp instruments properly while using it for the procedure or while discarding it after the procedure. So you have to take care while handling it and also while disposing it, so that you can prevent contamination from the sharper instruments. especially many of the children, those who are entering into newly into the profession, will start doing injection procedures first. So they may not know how to recap the injection properly, needles properly. So usually there can be chances of getting needle stick injuries in the first year students of nursing. So usually when they are taking care of that, they must be knowing the extra points of how to safely handle such needles or sharp instruments at the ward, like they can use ampules cutting. So ampule cuttings will be making injuries on their hands, unfortunately, while they were not handling it safer. So all these points they have to take care that they are not making any injury with the ampules or vials or the used needles for the patients. So they have to do proper management of disposal according to the hospital policy, because in some hospitals they remove the needle and put it on the yellow bags, or otherwise they will be putting it in the incineration and they will cut the needles which are used. So according to the policies of the hospital, a nursing student or a nurse must learn how to discard properly the sharp instruments in getting avoidance of needle stick injuries or prevention of injuries because of the sharp instrument handling. And if any sharp instruments, unfortunately, if you have pricked with sharp needles or sharp instruments, first of all, you must know how to clean it thoroughly, and you have to take that incident report to the infection control team of the hospital, and thereby you have to follow further of their instructions. Because once after the sharp needle stick injuries, you have to clean thoroughly with soap and water according to hospital policies, and then you have to report that incident to the infection control team. What these people will be doing, these committee people will make you to take you for further treatment of taking your blood samples to identify any infection has been crossed into your blood, and if anything is there positive, then according to that the treatment will be provided in the hospital only. So this is called as safer handling of sharp instruments. And the next one I told you is about linen handling and disposal. You know, in the hospital, we used to use more linens for avoiding the soiling of the bed at the hospital. So while you're tackling with the linens which are used by the patients, if it is soiled with the human body fluids, it must be taken extra care and concern while handling it and while disposing it. So when you are removing the bed sheets or linens from the patient's bed, you have to cover it properly, and then you have to put it in the laundry bag, and it has to be thoroughly sent properly to the laundry for the proper cleansing or proper washing or proper sterilization. So bed making and linen changing techniques has to be followed accordingly so that you can prevent the prevent contamination from the soiled linens of the patient. And then you have to prepare appropriate laundry bags for the soiled linens and for the good linens. And then if you are going to have any laundry hazards which has been happening in the ward, you have to take care. For example, while you are taking the linens from the bed of the patient, sometimes the body fluids you might have touched on your hands, or it might have spilled on your dress. So remove the dress properly and wash your hands with soap and water, and then rinse it with the running water. And you have to do alcohol rubbings on your hands so that you can prevent contamination further. So this is about the linen handling and disposal. Send the linens properly to the laundry for cleaning, and once after the cleaning from the laundry return, then you can use the bed linens for the patients. And remove the bed linens once it is soiled, remove it immediately. Don't wait for the next linen to come or 2-3 days after that only we will remove. Not like that. If the bed linens are soiled with the human biological fluids, it has to be removed immediately and sent for the laundry, because from this infections crosses more. And the next one is proper waste disposal. Proper waste disposal, many waste will be received in the hospital while taking care of the patient. Not only body fluids, but also the gauze pieces, cottons, or the drugs which you are using, ampules, vials, needles, syringes, or IV catheters, or otherwise gauges, that is the needles which you are using for the vent flanks which you are using for the IV insertion. Okay, so there are so many waste which will be produced in the hospital every day while you're taking care of the patient. Every products or which is being put up in the waste disposal has to be safely taken care, that you're properly disposing it according to the area where you have to dispose it. Otherwise, if you're not doing that, or if you fail to do that proper disposal, from there the contamination can be transferred from one place to the another, from one person to the another, and nosocomial infection spreads from the improper waste disposable management. So clinical areas waste will be one chances for high risk of transferring infection from one person to another. It may be potentially or it may be actually. What is the meaning of potentially or actually? Immediately also infections can be crossed, or tomorrow also infections can be expected from the improper waste disposal. So anytime you can expect an infectious diseases contamination transfer from one person to the another because of the improper waste disposal. So you have to see that while you're disposing the contaminated body fluids, objects or linens or gauze pieces or equipments or instruments, you have to stop the prevention of the infection from them. So dispose of them properly. And you have to dispose according to the colors of the bags. We will see that more detailedly in the biomedical waste management. But to be very simple and to be an information point, I'm telling you that it has to be kept in the proper containers, and those containers after filled must be tied properly before you take them for the disposal, like incineration. So how you have to dispose? You have to dispose in the proper bags, and the bags has to be tied before incineration, so that the untied bags will be spreading the contamination from them. So tie it properly and then send it for the incineration procedure. Incineration is nothing but a type of disposing of waste management. And this waste management disposal will have different policies from hospital to hospital. So where you're working, where you have been put up, so that hospital policy must be followed during biomedical waste management. Next is handling biological spills. Spilling is nothing but shedding out or splashing out on the area. Maybe while I was doing injection procedure, or while I was taking a blood sample, the blood human fluid spilled, or I'm doing a wound dressing, the bleeding has been spread up and the gauze while I was wiping has fallen down on the floor. So this is, we call it as spilling. So while you're spilling something, unfortunately it happens, mistakenly it happens. When it happens, how to handle those? Because from the spilling, if somebody touches that spilling or stamp on the spilling with a bare foot or wounded foot, then from that spilling contamination can be transmitted. So to avoid such contaminations, even the handling of biological spillings has to be taken care properly. So first what you have to do, cover the area with hypochlorite solution. Hypochlorite solution is a solution which is present in the hospital. You have to take that solution and see where the spilling has happened and cover that area for several minutes. And after that, you have to clean the area thoroughly with water and detergent and then make it the area for dry. It can be on a table, it can be on a floor, or it can be on the walls also. Anywhere the spilling happens, you apply hypochlorite solution for some minutes, leave that like that for some minutes, and then wash it with warm water or common water and detergent, and then you make it the area for drying. And this has to be treated as a clinical waste only. After cleaning, then you have to put it in the yellow bag and then it has to be discarded properly. So here also you have to follow the hospital policy strictly, as it varies from hospital to hospital. Next one is environmental cleaning. What is environmental cleaning? Hospital is an environment. So while you come inside the hospital, this is an environment where many patients comes in and out. Infectious persons can come, non-infectious persons may come, medical staffs are there. So it is a highly contaminated area where the contamination can be crossed from one person to the another very easily, even without a knowledge. So it is necessary that the environment or the hospital areas must be cleansed properly so that the contamination will be prevented for an extent. So proper maintenance or proper cleaning above all hospital area like physical structures, floors, walls, and all the beds and wards has to be cleansed properly, and laundries must be sent properly, and clean and decontaminate all the equipments and articles which are used in the hospitals also. So while after using one artery clamp for a patient, clean that, decontaminate it, and then use it for the other patient. That's how you can avoid the prevention of spread of infection from one person to the another. So that's so much of important environmental cleaning. You can see fourth class of workers will be roaming here and there in the hospitals, all the time mopping, all the time cleaning the floors by using detergents, Savlons, Lysols. Disinfectant solutions will be used for cleaning purpose every day, 3 times, morning, afternoon, night, even after contamination or spilling up of the body fluids. Every time people roam here and there in the hospital for cleaning purpose, and that has to be strictly monitored to avoid contaminations. And the next is risk assessment. What is risk assessment? Risk assessment has to be done by the infection control team or by the nurse every day at the hospital. What is risk assessment? Risk assessment is nothing but you can have some checklist or you can have some infection control technologies which will be written in the written format, and you can check it whether these are all happened or not. And this criteria will contain or tell you whether the hospital, particular ward or particular patients also are admitted there or coming in and out or are at the risk of getting infection or not. So this clinical assessment, we call that as a quality assessment also. It can be done every now and then in the hospital by the authorities so that you can see whether there is a chance of a risk at the particular place. So while you're assessing, it can be giving you 3 results. One is no risk, another one is low or moderate risk, or otherwise it will tell you the ward is of high risk. So while the assessment you do, you will get 3 results. One is no risk, another one is low or moderate risk, and the last one is high risk. According to the risk assessed, you have to take care of the ward and the patients to avoid transmission of infections. So if there is no risk assessed, then normal routines can be taken care, or normal routines can be done without any changing of the procedures. But if you have assessed a low or a moderate infection can be happen in the ward means, then you have to go for simple hand washing techniques or wear gloves and aprons, which is the next step after the simple hand washing technique, so that you can prevent infection by yourself and from you to the patients. And the next one is, if you have assessed a very long chances or very high chances of getting high risk, very high risk is there in the particular area for infection means, then you have to go for the complete PP kit. What is PP kit? It's personal protection equipments, including eye goggles has to be used, so that completely you can avoid infection transmission from one person to the another. So this is about the risk assessment, which will be done periodically by the infection control committee people, and they will assess the risk factors present in the ward or not. If they are low, then no changes or no necessities can be taken place. Normal routine care of nursing can be done. If it is low or moderate, then go with the next step of hand washing, like wearing gown, wearing aprons, etc. And if you have assessed very high chances of getting infection means, then complete protectional equipments, personal protective equipment, including goggles and shoes, can be used to protect the staff and also the other patients from spreading of diseases. And then final one is about staff health. What is about staff health? We medical staffs are working in the hospital with so many different kinds of infectious patients. So when they come, we are midst among them, we are in the midst of them, taking care of them. So we are more prone to get infection from the patients. So it is well and good that the hospital policy must have a policy or rule saying that the staff's health also must be taken care. So what can be done, or what they are doing usually to take care of the health of the staff working in a particular hospital. So here what happens, we are more risk of getting infection and also transmitting infection. It is not that you can only receive infection, not you will give infection to others, not like that. We are at risk to acquire infection and also transmit infection. So nursing staff or medical staff must be taken care with an extra care, so that they will be preventing the diseases. So what you will do, if you have acute infections, then you have to do immunization. We call that as vaccination. Do hepatitis vaccine, do corona vaccine, or do any vaccines which will be preventing the diseases in the hospital, especially bloodborne diseases. Okay. And if you have any lesions while working, lesions in the sense small wound, small sharp instruments cutting, if anything is there in your hand open, then you have to cover them with the waterproof dressings, so that it will not disturb the daily routine of taking care of the patient. And also, because of taking care of the infectious patient, no infection will be crossed through the open wound. So such waterproof dressings can be used on open lesions. Do avoid non-immune or pregnant staffs to work in the hospital. If I am a staff or medical personnel with a low immune system in me, I should not be allowed to take care of more infectious disease patients. Or otherwise, even a pregnant mother should not allow to take care. Pregnant staff nurses also should not allow to take care of infectious patient. Why? During pregnancy, during my immune power is less, that time I have more chances of getting diseases from the infectious patient. So such staffs can be isolated from taking care of the highly infectious patients at the hospital. And if anything is there as a nurse while you're working, you got an injury, sharp needle injury happened from an infectious patient, while you're taking care of an HIV patient, you got a cut and their blood spillings has been, you have come into chances of touching of an HIV patient's blood or hepatitis patient's blood, then you have an open wound. Such incidents has been reported to the infectious control team of the hospital immediately for doing further treatment or management for such incidents. And again, everything what I have told in the top points must be done according to the hospital policy of an individual hospital where the medical staff is working. So from the above points, I told you about many technologies like aseptic, isolation, then I told you about safer handling of the sharp instruments, handling of the disposal, handling of the linens, everything I told you. Apart from all these things, barrier nursing technique has two very simple techniques, which is we call it as hand hygiene and isolation. So while you follow these two things without fail in your day-to-day practice of taking care of the patients in the hospital, the almost 50% of the barrier techniques will be followed or will be catched up. So hand washing and isolation, a medical staff should never forget when you're taking care of an infectious patient. Okay, now coming to the effective barrier nursing. I told you about all the other steps like how you will be taking care. Now I wanted to tell you some of the effective barrier nursing. Follow these steps also so that you can avoid avoid infections. Along with simple hand washing, isolation, you can follow these steps also so that more effectively you can follow barrier nursing in your profession. The first point is equipments used separately. While the nurse taking care of a patient in the hospital, especially infectious or contagious patients, you have to use all the equipment solely for the particular patient alone. Don't use those equipments to the other patients after using to a contagious patient. Then that will spread the disease from one person to the another. So use separate articles or equipment for the contagious patients alone. Second thing is use protective clothings. Protective clothings like gowns, aprons, gloves, caps, and which can be disposable alone. So disposable usage of gloves, aprons and gowns, aprons, caps and gloves if you are using, which is a disposable, then that will be more better while preventing the infection from one person to the another. And next point you have to remember is limiting of staffs. You have an isolation ward where you will not allow too many staffs to enter into the isolation ward to take care of the patients. What happens if too many staffs come in and out of the isolation ward? There will be more chances of spreading diseases from the isolation wards to the non-contaminated wards outside. So limit the staffs who are circulating inside the isolation ward so that you can avoid or minimize the chances of getting contamination to the other contamination and non-contamination areas. Okay, so cross infections can be minimized. Next is limit the visitors. There are patients kept in the isolation wards, but we allow so many visitors to visit them. What happens? Visitors often come and visit the isolation patients, and then they go outside and they give others those infections. So you have to maximum avoid visitors visiting the isolation ward patients. Next is decontamination of articles. I said in the first point, separate articles has to be used. That means you are not going to use the same articles for the other patient. Not only that, you have to concentrate on decontamination of the articles. Contaminated articles after used articles for a contagious patient is an article which is contaminated. Now, contaminated articles has to be separately taken care by cleaning, rinsing and sending it for sterilization, autoclaving, whatever it is. Any method can be followed and decontaminate the articles for the next usage. So, when you do periodically decontamination of the articles and equipments after every use, then that will be better chance of avoiding infections. Next is limit movement of patients. Now I said you have to limit the visitors. That means visitors are not allowed to visit the patients. Not only that, you limit the movement of the patients. What patients will do? They will be in the isolated ward. They will feel isolated, and anytime they will come out of the ward and they go and visit the neighbors. So that also has to be avoided. What I tell you is unnecessary movements or transportation of isolation ward patients must be avoided. Even you have to transport a patient once in a while for the other investigation purpose. If you are sending them to a radiotherapy unit, that has to be sent when it is most necessary. If not, don't send them. Otherwise, unnecessary movements from one place to another of a contagious patient will easily spread diseases from the one person to the another. So if you follow some of these points also, using separate articles, decontamination of articles, avoiding limited staff, avoiding more staffs, avoiding more visitors, avoiding unnecessary movements of the patients from one place to another, these points will also help you to act as a barrier nursing, and barrier nursing can be effectively performed in the ward while you're taking care of contagious patients. What can be done in the barrier nursing? We are protecting the patients from three different problems. One is, it's a contact precaution. Contact diseases has been prevented, will be prevented by the barrier nursing. You can prevent airborne diseases and you can prevent droplet infections. So contact precautions, contact diseases are what? When we touch the infectious patient, we'll get from the contact. Airborne, from the air surrounding in the environment. Droplet, again through coughing or sneezing. The droplet infection which comes out from sneezing, that will be spreading diseases. So if we wanted to prevent all these three different infections, we have to use barrier nursing. That barrier nursings are called as contact precautions, airborne precautions and droplet precautions. Now recently, apart from these three elements, another three elements are also has been added. One is respiratory hygiene, second is safe injection practice, and third is use of mask while doing procedures. Usually we do not use a mask while we are doing some epidural anesthesia or spinal anesthesia. When we do that, we won't use. But nowadays, it has been newly added that even while you are doing any injection or catheter procedures, you have to use face mask so that you can avoid infection from you to the another patient from the medical staff to the patient or from the infectious patient to the medical staff. So now let us see very fastly what is about contact precautions, what is airborne precautions, and what is droplet precautions. What is contact precautions? There must be a clean and non-sterile gloves has to be used. Okay, this is nothing but when you are doing touching the patients while taking care of the patients in the hospital, you have to see that you are not coming into direct contact with the patient. So direct contacts, how it can be prevented? You can use clean gloves also while touching the patients for simple procedures. If it is a sterile procedure, then use sterile gloves. And you can go for gloves, use the gloves once it is while providing care to the patient, and once the procedure is done, change the gloves and wash your hands after the gloves. And when you are changing gloves, when you are touching a infectious material, then you, before touching the other patient, change the gloves. So these are some of the methods that you will be using as a protective clothing. Even in the gloves, these many precautions has to be taken while you are coming in contact with infectious patients. Okay, so proper use of protective gowns, aprons, caps, gloves, everything will help you to avoid contact precautions. Again, I told you, limit the movement of the patient from one room to the another. And then if you have infectious patient or colonized area where spilling is done, so cover that area properly so that the infection will not go from that place to the another. People will not stamp it and take it to the next room. Okay, so such precautions also has to be done. And you have to ensure that all the bedside equipments which are frequently touched must be sterilized or decontaminated periodically or often while touching that, because while touching that, contact infections can happen. So these are some of the points which you have to keep remember while taking care of the contact contagious patients. Next is airborne precautions. What is airborne precautions? It is used to avoid the transmission of airborne diseases, especially respiratory disorders will be crossed from one person to the another while we are taking care of the respiratory disorder patient. So there can be microorganisms, even a very minute, smaller microorganisms which will be present in the air can enter into the body while you are taking care. So what you can do, keep the patient in the isolation room. We'll either call that as the negative air pressure. So what is negative air pressure? Here there will be negative air maintained inside the particular isolation room. To be simple, isolation room will have a negative temperature where the outer area will have more temperature. So the temperature of the outer room and the isolation room will be different. Here we will maintain it in negative points, where in outside it will be in positive points. Okay, so the air conditioner will be there in the isolation rooms, so that outside room temperature will be different than the isolation room. So what happens, what is the use of this airborne precaution by keeping the patient in an isolation room is, the air will not, once when you're keeping up open of the isolation ward, the air from the negative pressure will not go outside. So the air which is containing contagious microorganisms in the negative room will not go to the non-contaminated room outside, even the doors are open due to the negative pressure. Rather, from the outer area, that is uncontaminated area, from outside the isolation room, that air will come inside and purify the air inside the room. So this is about the isolation ward. So this can be done for preventing airborne disease conditions. Apart from that, you can make respiratory protections. Okay, if respiratory protections can be done by using mask. Okay, masks can be used, use of mask. And even you can keep the closed doors has to be kept, so that from this room, the outside room will not be crossed with the contagious things. And also you have to limit the movement of the patients. And if such isolation rooms are not available, you can have screens to be separated, or glass areas has to be kept so that the patients can be separated from each other. Next is droplet precautions. What is droplet precautions? Droplet precautions is something when you cough and sneeze, the droplets will be falling down, and from that the microorganisms will be transmitted. So how can you use barrier nursing precautionary techniques for avoiding the spread of droplet infection? First one is you have to reduce the transmission of larger particles. Droplet infections will have bigger microorganisms in it, so that also has to be prevented. How you can prevent? You can keep distance. Larger microorganisms cannot travel for a longer distance. Okay, so you have to keep distance between the infectious patient is about 3 feet, so that the larger molecules of microorganisms, nuclei, will not cross the longer distance of 3 feet. So we call that as social distancing. Okay, so that can be happened, and you can keep a distance about 6 feet also. 3 feet or less than will be causing more infectious, whereas 6 feet above more will cause less infection. So 3 feet, more than 3 feet up to 6 feet you have to maintain between 2 different patients, so that you are avoiding droplet infections. And the patient can be kept in private room if the severe infectious is there, and you have to keep, definitely there must be a distance between 2 patients must be more than 3 feet. Okay, so thereby you can do droplet precautions. And again, in every precautions you have to limit the movement and the transportation of the patient unnecessarily. Use mask also, so that while you're coughing and sneezing, the droplet infection will not come out from the mask. Or you can use handkerchiefs while sneezing and coughing, so that it will not be spread out to others. And keep distancing. And here in droplet infection, you can even keep the doors open of a single rooms. Why? Because if you maintain social distancing about more than 6 feet, then there will be no chances of crossing infection from one person to the another. So you can even keep the close the doors of the particular rooms of the infectious patients. And I told you, apart from these 3, contact precautions, droplet infections, and another one is contact, airborne and droplet precautions. Apart from that, 3 new things has been added. One is the respiratory hygiene or cough ethics of using cursed handkerchiefs or wearing masks while you are coughing, especially for the respiratory disorders or respiratory infections crossing to be stopped. So what is that is? You have to keep all the personnel informed what is respiratory infection and how it will be crossed from one person to the another. That information will keep them updated, and they may not able to spread the diseases, while if they have informations regarding that. Give health educations. While coughing and sneezing, they have to cover with handkerchiefs the nose and the mouth while coughing and sneezing. And after coughing and sneezing, with using a tissue paper or napkin or mask if they were using, how to dispose that contaminated mask, how to dispose the contaminated handkerchiefs or napkins has to be taught to the personnel, so that they can avoid contamination. And using of mask is more important during coughing. So this is about the respiratory hygiene. Along with this, you can tell them to have alcohol based hand rubs. What we are now doing after coughing and sneezing, we wash our hands, or we have alcohol rubs, pour it in your hand and rub it properly, so that the microorganisms while coughing in your hands might be dying. Okay, so hand hygiene also has to be encouraged after every coughing and sneezing, and they should not touch the nose, mouth or ears or eyes after coughing and sneezing, so that they can avoid. And 3 feet distance. And health workers must use all standard precautionary methods like gauze, gowns, masks and caps to prevent themselves from the respiratory disorders. Next is safe injection practices. I said you already, while handling about the injections and needles, you have to be very careful, because needle stick injuries can transmit bloodborne diseases, contagious diseases from one person to the another. So correct disposal of sharp needles must be done in a correct container, and resheathing needle has to be avoided. After injecting procedures, in injection procedures, you should not recap the needle. That has to be discarded. Remove the needle also has to be avoided. Directly you have to go and keep on the incineration method, and the needle will be incinerated, then you can remove the cup and put it in the proper disposable container. So this is how we call it as avoid syringes as a single unit and avoid overfilling of sharp container. You discard the needles in a container and that should not be overflowing. So discard it before filling of the container. What happens when the container is filled? That they will flow down or they will fall down. So we can stamp on that and again needle stick injuries can happen in the ward. So such a safer injection practices must be done by the nurses as a barrier nursing. Mask usage is too important. It's a very simple thing, but it has to be used during catheter insertion and also injections given for spinal and epidural. So while you do masking during these procedures, it is well and good that you will be avoiding the infections to cross from yourself to the patients while injecting catheters. So these three, using of mask during procedures of catheter insertion and injection procedures, safer injection practices and cough ethics are newly added up in the barrier nursing, which has to be taken care along with the contact precautions and droplet precautions and airborne precautions. I wanted to show you a picture of isolation room also. See, this is the picture where there will be division between the two rooms and one single bed will be there here, and thereby the patient will be taken care and the external environment will be completely covered by the walls, and there can be negative pressure inside the room so that the contamination will not be crossed from inside to outside. That is how the isolation rooms will be in the hospital. So we are at the end of the today's class, we are coming to the end. What is summary? What we can do in the isolation? Ideally in the patient world or in the world of hospital, medical staffs request more barrier nursing technologies to be followed. Why? Because they can protect themselves and also they can protect the patients from getting infectious from one another. So even though there is no luxurious facilities present in the hospital where we are working as a medical staff, don't worry, at least you have to follow simple hand washing techniques, isolation techniques and protective equipments if you are using. That alone will do as a barrier nursing to protect yourself from the infections, from the infectious patients, and also you can protect the patients from your infections to cross over to them. That's how barrier nursing works, and it is so important for a nurse to follow barrier nursing technologies inside the hospital every day while taking care of the patient. Thank you.